Good morning. This is Dr. McDaniel at GYN Corner. I'm a board-certified obstetrician gynecologist in New York City, and I'm bringing to you all things health-related for women. So let's see. Today I am at the horse farm. We live in New Jersey, and the horse farm is in Morganville. It's called Baymore Farms. It's a good farm. The girls have been taking horse riding lessons, equestrian lessons, for 10 years now. Well, Jill's been taking for 10 years. She started when she was 5. She's 15 now. And she started 2 weeks after her 5th birthday in January. And Joy, who is 10, she's been riding for 7 years since she started when she was 3.5. So we're here every Saturday, and I'm walking around. We had a big snowstorm earlier in the week. We got about, where we live, we got about, I think it was, I can't even recall anymore. I think it was a foot, maybe 6. It was between 12 and 16 inches. I can't even recall anymore. It was between 12 and 16 inches. And here in Morganville, I think they got about 16 to 18 inches. I'm not 100% sure. But the snow is melting and it's compacting, so I'm standing on snow right now, but it's fairly firm, so I'm not sinking through, and it's about maybe 9 or 10 inches of snow that I'm standing on, so it's kind of funny. But today, as the title indicates, I am speaking about blood clots. Now, there are lots of different types of blood clots, and I'm not speaking about the clots people see when their cycle's on. I'm talking about the clots that we don't see because they're in the body. So medically, we call blood clots in the body thrombi. If it's just one, it's thrombus. If it's multiple, there are thrombi. And a blood clot in the body is always in the vascular system. So it's in the venous system. Occasionally, it's in the arterial system. But predominantly it's in the venous system, and clots occur for a variety or a multitude of reasons, but the most predominant reasons, the top reasons are that there is a lot of turbulence in the blood vessel. So instead of the blood just flowing straight through, kind of like a highway or a motorcade, it swirls around like you're stirring your coffee. And as the blood swirls around, because of the disturbance of the lining inside the blood vessel, as it swirls around, it slows down. And when the flow slows down, it has a chance, the little cells inside of it, they have a chance to accumulate, to clump up together, and they form a ball of blood vessels. Sorry, not blood vessels, a ball of blood. And that's a clot, a blood clot, or a thrombus. One of the top reasons is just when someone's immobilized. So say they're sitting in an airplane, transatlantic or transpacific, and say they're sitting there and they don't move. They try not to drink fluid so they don't have to get out and go to the restroom. They just sit there for 8 hours immobile. They don't even stretch out their legs because they're an economy. Maybe there isn't any leg room and they're really tall. So they just sit there for 6 to 8 hours. The blood flow is decreased because when we walk around, the muscle action in our legs actually helps to pump the blood returning to the heart back up to our heart. So there's decreased blood flow when you are not mobile. So if they're sitting there on the plane for 6 to 8 hours, the blood flow will slow down. We all know their ankles may get swollen. That's another factor. The ankles get swollen because the lymph system and everything is not flowing back up. So it's much easier, and that's one of the primary reasons for a blood clot in the legs, a thrombus in the legs, and we call that a deep vein thrombosis. Another reason is if someone has a genetic predisposition. So there are several genetic predispositions which make them hypercoagulable, so gives them an increased risk for their blood clotting. And sometimes that will happen at the least provocation. So they may be sitting in their car on a relatively short trip, say 2 to 3 hours, and they could get a clot in the leg. Or surgery. So if someone's had especially pelvic surgery, that can disrupt the vasculature and a lot of scar tissue and healing. That can increase the risk of blood clots. Cancer can increase the risk of blood clots because of the factors that the cancer cells promote. It can affect the clotting behavior of the cells inside our bloodstream. So those are some. Oh, and pregnancy. I don't know how I could forget pregnancy. Pregnancy can do it because of the high estrogen state. So the high estrogen state will increase the coagulability of the blood vessels, and in the same vein, no pun intended, it will be if someone is on a high dose birth control pill because of the high estrogen state. We don't really have high dose birth control pills anymore, but they may have a slight provocation, genetic disposition, or some trauma to their blood vessels, and then even a moderate dose pill might be enough to push them over the edge. And then I guess the last one, we don't prescribe hormone replacement as often anymore, but if someone has a slight provocation and they're on hormone replacement, they're not supposed to see so much estrogen, but for them, because they're postmenopausal, it's quite a bit more estrogen than their body is used to seeing. That too can increase coagulability. And I had a colleague, she had no problem. She had 3 pregnancies, 3 children, had been on birth control pills most of her reproductive life. She went through menopause, went on hormone replacement, and she got a blood clot, and she had a small stroke. So you never know what factors may end up aligning. So those are the main factors that can cause increased blood clots in the vascular system or in your bloodstream. And we call that a hypercoagulable state, so it clots up easily. And then when you get a blood clot or a thrombus, depending on where it formulates, it can travel downhill if it gets ripped off of its base. So if you get a clot in the leg, we call that a DVT, or a deep vein thrombosis. If it travels and then that clot goes, or sometimes it won't be in the deep veins, it'll be in the superficial veins, so then it's called a superficial thrombophlebitis. Those are more obvious. So the DVTs sometimes will go unnoticed as just maybe a muscle ache or a leg cramp, and it's usually the calf. Very rarely is it the thigh. It's usually the calf, and they'll just feel like a deep ache or sore pain. And then sometimes, because of the inflammatory reaction around it, the calf will start to get swollen, and then more painful with the swelling and the pressure. If it's in the superficial veins, a superficial thrombophlebitis, it'll be red and hot. You'll see a spot that's red and hot, and you may even feel a hard kind of like little pebble or stone underneath the skin. And then if they get broken off, the deep vein ones, the DVTs, if they get broken off and they travel up the venous system, then they can go to your lungs. And when it settles in the lungs and clots in the lungs, we call that a pulmonary embolism, because once it's been ripped off of its base and travels, now it's an embolism, not a thrombus. The thrombus is sitting still or formulated, and the embolism is the traveling clot. Sounds like a band, traveling band, but it's traveling clot. And that's a pulmonary embolism. Pulmonary embolism has a 50% mortality rate. So half the people who get a PE or pulmonary embolism will die. And if it travels up to the brain, then it's a stroke. And we call that an occlusive stroke as opposed to a hemorrhagic stroke. So an occlusive stroke is a clot, so it's cut off the blood flow to the areas downstream, whereas a hemorrhagic is a vessel that pops, ruptures. So those are all of the main ones. And then a small percentage of people, if they have like a heart valve, a mechanical heart valve, they can potentially get clots on that mechanical heart valve, and then that could get thrown off and cause problems also with emboli. So I'm going to stop there because this has ended up being a little longer than I anticipated. I'm trying to keep these relatively short. I am quite loquacious, and I always have a lot of information to give on these topics. So I'm going to stop there. That's part 1 on blood clots, and we shall reconvene with part 2 on blood clots. Thank you for joining me on a wintry, blustery, snow-packed day. Ooh, geez, sorry, I almost dropped the phone. Here in New Jersey. I'm in Morganville today at the horse farm. I hope you have a great rest of your day. Can you see this pile of snow behind me? Where'd it go? Actually, I can't even see it myself. Oh, there it is. I hope you have a great rest of your day. And join me on the other platforms. Our YouTube channel is GYN Corner, and the podcast GYN Corner. Thank you. Bye.